Hey guys, welcome back to another episode of DePasquale TV. There are so many great clients that come into DePasquale. We love to see them and hear their stories and know a little bit more about what they do in their lifestyle. So we're always excited when we have the opportunity to bring one on the show. And today we have somebody very special.
We are so excited to welcome Dr. Anika Ackerman. And honestly, let's just bring her in so you guys can meet her and how fabulous she is.
Yes.
Dr. Ackerman, thank you so much for coming in and speaking with us today. We're so excited to have you here. Can you tell us a little bit about yourself?
Sure. Thank you guys for having me. I love this place, so I'm always happy to come back to DePasquale. I am a urologist. I work in Morristown at a Morristown hospital. I have an office in Morristown as well as an office nearby in Mountain Lakes. I trained in urology, mostly general urology, which encompasses male urology, female urology. And now as a female, I see a lot of female patients, so I specialize in female urology mostly, but I still treat things like prostates and kidney stones, so I see men as well. But recently I've been seeing more women, especially with the new interest in menopause health and perimenopause health and female sexual dysfunction and health. So that is my bread and butter currently.
Yeah, it's exactly what I was going to lead into. I love opening this conversation up because, you know, it's not all these topics I don't think are talked about as much. We're getting there. But talk to us a little bit about what you're seeing now, women coming in, talking about perimenopause, menopause, and different tips that you have.
And you're definitely right. The floor is now open. There's so many people on social media, and it's probably because I'm in this field. I just see it everywhere, and it's just compelled me to make my own social media. So I have patients coming in from social media because I talk about hormone replacement and symptoms of menopause and perimenopause, which is defined as the time in a woman's life when her ovaries shut down. The average age in the United States is 51. And that means that women 45 to 55 is really the average time that women are going through this. But perimenopause can precede menopause by 10 years.
Wow.
Whoa.
So if someone's going through menopause at 45, you can actually start perimenopause at age 35. So we'll often see women in their mid 30s, late 30s, 40s who are experiencing these symptoms.
Yeah.
And a lot of doctors don't realize that they say they're too young for perimenopause, and it's not that, and it's something else. And so now we recognize that, and we can treat those women. Symptoms like hot flashes, night sweats, disturbed sleep, anxiety, sexual dysfunction. The list really goes on. Joint pain, hormone-related migraines, so many things that a woman goes through at this time in their life. And it's really good that the word is getting out because for so long women just suffered.
I never knew it could go up to 10 years.
Yeah.
That is, at 35, I never would have thought you could be going through that.
Right.
So could you talk to us about hormone replacements and what it is and more about that?
Definitely. Recently, they looked at women aged 51 to 59, appropriate age for hormone replacement. And we actually found hormone replacement helps to decrease bone fractures, decrease osteoporosis, decreases 40% of cardiovascular events and all-cause mortality.
What would you say is some self-care options that would benefit or add on, I think, to that? Because I think it's important to always be taking care of ourselves in multiple ways. And women tend to leave ourselves way last when it comes to everything.
Totally. I mentioned before, anxiety is something that happens in perimenopause, menopause. Actually, interestingly, when they did that study and they took everyone off their hormones in the early 2000s, the level of SSRIs, so things like Lexapro, Zoloft, all those drugs, they went like this. So as the hormones went like this, the anti-anxiety medications went like that. Anything you can do to diminish anxiety, working out, always good. Also good for your bones. Massage is a good one. Massage, something that's done here, has actually a lot of health benefits. It increases your endorphins, which helps to lower stress, but it also decreases your stress hormones. It increases oxytocin, which is a hormone that comes from your brain. It's the love hormone. And so it can increase your libido. It can make orgasm better. So massage is not a bad thing.
It has a lot of benefits.
For sure. And then other things like, skincare, anti-aging, everyone wants to look good. I see a lot of women in menopause who are like, I feel fat, I feel dry, my skin getting wrinkles. So they're putting estrogen in skincare. They're making face creams that are estrogen based. But things like facials and just taking care of your skin, having a good routine.
The overall.
Will
Yeah.
be important.
It like kind of completes the whole package.
Yeah, for
of
sure.
Taking care of yourself.
For sure. I see
Oh,
patients
wow.
every day that are told by their doctors, hormone replacement's not a good idea. This is a rite of passage. Menopause is just something that women go through, and they're suffering, and it's like really not necessary.
I feel like we hear that term like rite of passage like
Yeah.
all the time. It's like, don't make your body suffer any more than it needs to. Like help yourself out.
Honestly,
Take care. I love that you're talking about it. Your page is great.
Oh, thank you.
I mean, it's so much fun, and I think you make it not a scary topic.
Right.
I like that though. I
Yeah.
think it's important. I am a big advocate of finding someone that like fits and knows versus just like going and thinking like someone covers everything.
For
you know?
sure.
Like
Yeah.
thank you really so much.
So
This is
much,
absolutely
yeah.
incredible.
My pleasure.
If you guys want, remember to like and subscribe and follow us. Thanks for watching.
Thanks for watching.
Bye.
Bye.